Hi guys. Okay, let's do chapter 29 and chapter 91. Again, I'm just gonna go right through them, okay? So, chapter 29, page 331. The structure and function. The female reproductive system consists of paired ovaries and oviducts, and the uterus, vagina, and external genital structures. The internal organs, uterus, vagina, and ovaries are located within the pelvis between the urinary bladder and rectum and are held in place by a group of ligaments. The external structures make up the vulva, the mammary glands, which are breasts. The external structure makes up the vulva. The mammary glands are also considered female reproductive organs. Okay, so reproductive organs. We have the ovaries, or the gonads, the sex organs in women are the ovaries. They produce female gametes, or the ova, little eggs, and secrete female sex hormones, estrogens. There's several estrogens that exist. The primary one is estradiol. The entire classification, estrogen, commonly refers to all female sex hormones collectively. So then blah, 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 blah. There's a beautiful picture of the female reproductive system on page 332. So then you have what's called the oviducts, or the fallopian tubes, or is a common name. Basically, they're there to capture the egg. So let me talk about this and I'll talk to you about it. Then you have the ova. So the human ovum consists of protoplasm enclosed within a two-layered cell wall. So the ovum bursts from the ovary into the pelvic cavity. Okay, so cool. Everyone thinks that they're connected, but they're not. So you have, here's your ovaries, and then you have the fallopian tubes that connect to the uterus. So every single time you ovulate, that ovary is being ejected. There's a little ovum that just ejects from literally bursts from the ovary cavity, the ovary, and then the fallopian tube is this it sucks it in. So sometimes though, if it can't get it, then it just escapes and goes into the abdominal cavity. Whereas most of the time though, it's trying to get it, and then smooth muscle, it travels down, and then that's where it gets pregnant, or that's where it gets fertilized. So smooth muscle helps move the ovum toward the uterus. And so those little little thingies, you know what I'm saying, are called fimbriae, and that kind of helps collect it. And then know though that cramping can happen. Test question. Cramping can happen from ovulating. So that's what is called ovulating, is when that little ovum escapes the ovary and then the little fallopian tube catches it. Okay, so know that it is the oviduct, or the fallopian tube, that is ligated or tied and cut in the female sterilization procedure called tubal ligation, or I got my tubes tied, is another way people say it. So, nursing alert. An ectopic pregnancy, or outside the uterus within the oviduct, is an emergency situation, endangering the life of the mother. In this situation, the fertilized ovum becomes lodged in the oviduct. This can lead to ductal rupture and hemorrhage. So that tube is only so big. If a little egg gets fertilized in there and it starts growing, it's going to burst and it's going to cause major issues. And so they haven't been able to find a way to implant that little egg into the uterus. Hopefully someday they do, but as of right now they don't. Okay, so then you have the uterus, or the womb, is a hollow, musculature, upside down, pear-shaped organ. The uterus is freaking awesome. It is such a cool organ in the body. Okay, so during pregnancy, it increases about 16 times the size of it normally is. And then you have different parts of the uterus, like the fundus is around upper surface. That's where they massage the fundus, and they massage it. But if you just anyways, we can talk more about that later. So then you have, at the end of the uterus is the cervix, which is the narrow lower end. That's the passageway into the uterus. It's a nice little white circle-shaped, donut-shaped little structure. And when you don't have a baby yet, it's a nice circular opening. But if you have a baby, it can be straight, vertical, or horizontal. It'll appear differently. So that's how you can kind of tell if somebody's had a baby or not, if you're doing a pelvic exam. Okay, and then so let's see here. So then you have the mucus layer, the endometrium of the uterus, forms the maternal portion of the placenta during pregnancy. The uterus receives the fertilized ovum and provides housing and nourishment for a fetus. So at the end of gestation, the uterus expels the fetus, delivery, blah, blah, blah. So just know that the uterus, like, it'll sit in there like this tiny little thing, and then it'll, like, literally grow. And then since it's, like, such an awesome muscle, it'll, like, contract back down. And only females have it. Sorry, guys. But it is, like, the coolest thing. It's amazing. Like, it's amazing how that kind of stuff works. And just know that when you're having a baby, it knows exactly what to do. There's, like, you can kind of control it, but that uterus is, like, got a mind of its own. And it will get the job done. Like, your body will have that baby. Even if you don't think you know what you're doing, your body does. So if you just go with the flow, ride the wave, you're going to get a baby out. So if you have any friends or if you're pregnant, then just tell them, like, don't worry about it. It's going to happen. It's going to happen just fine. Okay, so that's my little spiel. The vagina. So the cervix projects into a fibromuscular canal about 4 inches long called the vagina. Blah, 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 it's attached to the uterus. So just know that there is glandular secretions, such as the Bartholin's glands, that's the greater vestibular glands, and the mucous membrane lining its walls moistens the vagina. The mucus is acidic and retards microbial growth. So that's why the semen have to secrete that alkaline solution in order for them to even be viable inside the vagina. There are called rugae, R-U-G-A-E. They're expandable folds within the vaginal walls. They accommodate the insertion of the penis and passage of the fetus during childbirth. It doesn't feel that great. The vagina's functions are to receive sperm, provide an exit for menstrual flow, and serve as the birth canal. Okay, so then you have external genitalia. There's a picture on page 333, figure 29-3 of all about that. So let me just see here. So you have the mons pubis, the top, then you have the labia major, the outer part, labia minor, the inner part, and then you have the clitoris, which is right up there. It's usually so it's an erectile structure. It helps with sexual stimulation. Then you have what's called Bartholin's glands, which help lubricate the vagina. If those get obstructed, they can have cysts, and that can be super painful, and you have to go in there and you have to get them, like, taken care of, because otherwise it's super uncomfortable for women. And then you have the perineum, which is the space between the vagina and the rectum, is that skin right there. It's very muscular, and it helps with, like, the Kegels and contracting, and, like, helps with, like, everything. However, that's, like, the most likely place to get torn when you have a baby. And so when that happens, there's different degrees, and you'll learn about this in term 5, I think. Anyways, though, just know that it can, like, get torn and it hurts. And this key concept says that an episiotomy is actually better to do than to let it tear, because straight skin heals than jagged skin. I disagree. Don't just get an episiotomy prophylactically. Just let your body do what is needed to do. However, you can help the woman by, like, stretching the area with, like, an oil and helping guide that baby out and slowly letting it out versus just, like, it, like, tearing sometimes from, like, a rapid birth. So just don't, like, cut it and then just hope it happens. So it's not fun. And there's, like, different degrees, like 1, 2, and 3, depending on, like, how, like, far next to the rectum it is. Okay, anyways, so there you go. And that's called, anyways, okay. Okay, so then you have the breasts, which are help with, they grow in puberty, they help in feeding your baby, and they're part of, like, sexual life, blah, blah, blah. Super important. So inside of them you have what are called mammary glands. And so then the hormones prolactin and oxytocin stimulate them to produce and release milk after childbirth. So there's about 15 to 20 lobes of glandular tissue covered by the adipose fat tissue, which gives the breast its shape. Blah, blah, blah. So hormonal release of estrogen and progesterone during pregnancy causes the breast to enlarge. The areola also become more heavily pigmented and do not totally return to their previous color after pregnancy. It's all about blood flow. More blood is going to make things a little bit more darker. So think of the mammary gland. So you have the sunflower, right? So the petals are those globes that are filled with like the little milk ducts. And then, like, the center of the sunflower is, like, where all, like, the milk ducts meet. And, like, the nipple has, like, it's not just one hole that the baby's eating from. It's, like, 20 different holes. And so when they get big, they bloom. And then they shrink when the baby eats. Just know that breast tissue can travel all the way up to the armpit, because when I had a baby, you get engorged because everything's, like, filling up. and my armpit got engorged, and I was like, what the heck is this? So it's totally normal, and when you breastfeed, it goes away. However, I feel really bad. I never knew this before I had a baby, but if a woman's enlarged and the baby's just like not able to get everything out because you're producing so much, just pump it out and just save it. Just be careful though. The more you pump, the more you'll produce, which means you have to just keep pumping and everything, but your body will regulate. So I know this is like off topic anyways. So just tell a woman if like they're engorged and they go, I don't know what to do, everything hurts. Say cabbage leaves will help, and then just pump it out. Either hand express or get a pump and just do it. It really helps it out. Helps with that engorgement, just like a relief. Anyways though, just know that the hormones prolactin and oxytocin help with the production of that. Okay, blah, blah, blah. So hormonal influences, the hypothalamus, pituitary, and gonads all contribute to hormonal regulation of the female reproductive system. The hypothalamus stimulates the secretion of gonadotropic hormones, which include luteinizing hormone and follicle-stimulating hormone in women. The main effects of LH and FSH include stimulating both the formation of ova and the secretion of hormones from sex organs. Let's see here. And then, okay, long thing I wanted to read, but I think it's super important. The pubescent girl exhibits many changes as a result of estrogen production. Characteristic secondary sexual characteristics of the female include a smaller stature, higher percentage of body fat, pubic and axillary hair, and development of breasts. The female pubic arch of the pelvis and hip structure is wider than that of the male to facilitate childbirth. So that's when they're like, when they like look for, like they find bodies like buried, and like archaeologists, they'll like measure the hips and they go, oh, this is a female, this is a male, blah, blah, blah. Anyway, so sweat glands also become more active. Although voice changes are not as marked as those in a boy, the voice does deepen and mature in tone and quality. As glands of reproduction become active, menstruation occurs. All female secondary sex characteristics depend on secretion of estrogens and progesterone. Progesterone is what keeps you pregnant. So just like that hormone, think of like that's the pregnant hormone. So system physiology. This talks about the development of the egg. So in humans, all the ova, egg cells that an individual woman will produce in her lifetime are present as oocytes at her birth. You were born as a female with the number of eggs you will have your entire life. And so just know that over time, only 300 to 400 eventually develop into mature eggs. That means your entire lifetime, you only have about 300 to 400 that could possibly become babies. So from like over 300,000, so about 5 to 7 million when you're born, then it goes away to about 300 to 400,000, and then by the time you're ready to like develop mature eggs, you'll have 300 to 400. Crazy. So let's see here. So then blah, blah, blah. So this ovum, when it's in the uterus, as it's going down, will live up to 24 hours before it begins to degenerate unless fertilized by a sperm in the oviduct. The fertilized ovum, the zygote, travels to the uterus. So it gets fertilized up in like the fallopian tube, and then it travels down to the uterus, it hangs out for a few days, and it attaches to the uterine wall. And then it starts like living off that endometrium layer. And then you just have like a baby growing in there. However, if it doesn't become fertilized, then it just kind of waits around 24 hours, goes in the uterus, and then like about 2 weeks later, you have your period. So that's kind of what's going on. So that's the beginning of the menstrual cycle. Or the menstrual cycle is like the first day of your period. So let's see here. So it talks about how the menstrual cycle is incongruent with the ovarian cycle and the uterine cycle. So let's see here. So just know this is a good definition to know. The first menstrual period of a female, is called menarche. It marks the onset of female puberty. And so give or take, the menstrual period is about 28 days. So like if you want to like mark it on a calendar, like if you know of anybody that's trying to get pregnant, or just to like maybe they're trying to avoid getting pregnant, whatever, just mark your cycles so you know like when you're most likely to get pregnant versus when you're unlikely to get pregnant. Okay, so there's a picture 29.5, and I gave you a handout about it too. There's like all kinds of notes from Joan on there. That's really helpful. So day 1, first day of your period. So about 2 to 5, maybe 7 days or so, you have that. So just know from day 1 to day 14 is when you're gonna have So the period, you have a lay week, and then you're going to be fertile. So that's when you're going to ovulate. And then you have about 24 to maybe 48 hours of like a window to get pregnant. And then after that, then you have, I think what's called the luteal phase. Yeah, so then you have that other week, 2 weeks or so between the ovulate and your period. So just know like hormones fluctuating all the time is going on. Does this chapter talk about PMS? No. So the next chapter we'll talk about is like PMS, which is that's a real thing. I don't care what anybody says. So just kind of know this kind of stuff. It's really interesting. And then that menopause, it happens between 40 and 55 years of age. Totally normal. You're going to get hot flashes. Oh, you'll get hot flashes when you breastfeed. Just a heads up. You'll get hot flashes, hormonal disturbances or imbalances, all that kind of stuff. You can take hormones for menopause, but it does increase risks related to cancer. And we'll talk about that in chapter 91. So then you have the uterine cycle. So it's just let it know, like it goes with the ovarian cycle. So you have the egg that didn't get fertilized. So everything that was going to give nutrients to a baby that's going to grow in there just gets flushed out with your period, your menstruation. Yeah. So basically, the menstruation is a sloughing off of the endometrium and unfertilized ovum causing menstruation. It averages 3 to 5 days. Usually 7 is the standard amount of days. And then, yeah. Okay. So just know that when female sexual response, as you get excited, blood flow. Everything is all about blood flow to the reproductive organs when it comes to like all that kind of good stuff. And then it has the effects of aging on women's reproductive health. Just know as women age, things tend to get dry, so lubrication is super important for continuing to have an active sexual life or being with a partner, or et cetera, et cetera. And also know that structures may sag. We'll talk about that in chapter 91 too. Anyways, that is the female reproductive system. It's amazing. There's still like unknown things about it, which is crazy because so you can ovulate, like you'll feel those cramping on either the right or the left ovary, and they don't know which instigates which. So, yeah, it's kind of interesting, really cool. I want to talk more about it, but nah, it's okay. Okay, so chapter 91. Okay, so female reproductive disorders. I'm gonna probably skip some parts in here because there's a lot of information you don't really necessarily need to know right now. Okay, so gynecologists are the reproductive healthcare providers. That's what they're called. And then obstetrician gynecologists in regards to childbirth management. So they deliver the babies, there's cesarean sections. They're usually associated with that, like an OB. Okay, so you have what's called a pelvic examination. It's a procedure that is used to check the vulva, vagina, cervix, uterus, rectum, and pelvis for palpable abnormalities such as benign or malignant tumors. So sorry, chapter 91, page 1660 is where I'm starting off. Diagnostic tests, pelvic examinations. So before this pelvic, have her empty her bladder, and you're going to put her in what's called a lithotomy position. They're laying on their back with their feet up in the air, and everything is just open and exposed. So being sure to like cover them with a blanket and like getting them all prepped before the provider comes in is super important for like privacy, modesty, and just like comfort, I guess you could say, because no one's going to want everything out and about. And then you're going to set up your table with like any sort of like testing that you're going to need, lubrication. Then you have what's called a speculum, which is what they like, it's like that little, it kind of looks like duck bills, I guess you could say, like a duck, and you can like insert it, and then like it opens everything up so they can like visualize. And they usually have like a headlamp to like see in there, and like an external light that goes with it, or light attached to it. And then they can go in there with like a Q-tip sample and take samples of things, such as a pap smear. They go in there to like check like how the cervix is doing. That's not really super comfortable, so it can be a little like uncomfortable. It can be uncomfortable. That's what I'm trying to say. And sometimes that can even cause cramping for women. So tell them that's totally normal, and then just ibuprofen is the recommended pain medication if they want to take anything. Always be in the room with them when they're doing that, unless they're in a special like provider's office. But usually they have an assistant or somebody, just for like not only for like just comfort, but also like if you need to hand them things, but also just to keep everybody on the same page. So there's no like accusations or blah, blah, blah. So you're just kind of like there. You can be what's called like it's not like you're chaperoning, but like you're like, hey, I'm just here just to like help with things. Is what you say. Let's see here. So it also talks about how Pap tests should be done between a woman's menstrual periods, and tests are less accurate when a woman is menstruating. Some women have a higher than normal chance of contracting cervical cancer. These women require regular screening, sometimes more often than once a year. A huge reason nowadays why women get cervical cancer is the human papillomavirus, HPV. Test question. HPV is the main cause of cervical cancer nowadays. So just a heads up with that. So then you have like tests for endometrial cancer, so a biopsy. The endometrium itself is the best option for accuracy. So then you go in there and you like take it from like the uterus. You have blood tests that are with that. The CA-125, I've never done it or seen it, so but it's there. Let's see here. And then you have also like the human chorionic gonadotropin, HCG is another tumor marker used as an aid in diagnosing testicular and ovarian cancers. Okay, let's jump to clinical breast examination. So they recommend getting one of these done, a clinical breast examination from your healthcare provider about every 3 years. I'm definitely a huge proponent of the self breast exam, and that's on page 1667. So just like when you're in the shower or whatever, once a month, just kind of feel around, make sure everything feels normal. And if you feel anything abnormal, get it seen and taken care of right away. Let's see here. So then the mammography is an x-ray of the breast. They recommend doing that, let me see here, between the ages of 50 and 74, about every 2 years or so. Basically, you'll go in there, they put the breast in between two plates, they kind of squish it to keep it in place, and they take a picture to see if there's any sort of like nodules or anything going on in there. And then let's see here, there's other characteristics that'll make you high for risk of breast cancer. So a previous cancer, if you've never had children, or if you have children over the age of 35. Let's see here, hormone therapy is a big thing. Yeah. So the interpretation, tumors may show up on a mammography as denser than normal breast tissue. The radiologist can speculate whether a tumor is malignant or benign based on its shape, location, and size. If a lesion is present, a biopsy is usually done. Then you have an ultrasound, which is also a great thing. So ultrasound is being used more frequently with young women with dense breast tissue who present with breast lumps. So they'll do the ultrasound versus the x-ray. Then they have biopsy, blah, blah, blah. So other diagnostic tests, you have an abdominal or pelvic ultrasound. So the ultrasound, they use high frequency sound waves to like get the image. Just know that they can do it externally over the abdomen just to see kind of what's going on. Or they can do it internally in what's called a vaginal ultrasound to view the pelvic organs that cannot be seen in any other way. So that can also be a helpful thing. They usually do like the vaginal ultrasound for like an early pregnancy, like for like the first trimester. And then after like that, then they go more of the abdominal ultrasound. So laparoscopy is a diagnostic test that provides direct visualization of the uterus and accessory organs. They're going to go right through your belly button, the umbilicus, and they're going to inflate your belly with like 2 liters of carbon dioxide so they can see everything. Sometimes they tell you to leave your bladder full so that way they like see the organs, they don't mess with it. Just know that it can be painful, and the nursing alert talks about shoulder strap pain. So it's pain under the clavicle. Report any abnormal pain to the provider. Know that this gas will subside, and just walking and moving is going to help get it out more. However, if sometimes it can be gas, or it can be blood accumulating under the diaphragm. So it's really important to like see if there's any sort of check their vitals, see how they're doing, see how they're going, and everything like that. If they don't look good, they don't feel good, don't mess around, don't wait, call somebody right away. Okay, then you have what's called the colposcopy. Colposcopy furnishes direct visualization of the uterus, the oviducts, the broad ligaments, colon, and small intestine. So an endoscope is passed to the vaginal wall behind the cervix after a small incision is made in the posterior vaginal cul-de-sac. So they go right in there. So this procedure is also used to diagnose pelvic pain, tubal pregnancy, and pelvic masses. So if you're like a post-surgical nurse, this is like really good stuff to know. Then you have other things. I'm going to skip down to the dilation and curettage. So a DNC, dilation and curettage, is the most frequently performed gynecological surgery. So it can be used to diagnose tons of disorders. So basically a D&C takes approximately 15 minutes. It is often done in a day surgery department at an outpatient basis. It's done to diagnose things, it's done to clean things out. So they go in there through the cervix and they clean things out, and then they just like take it out, or they take samples or whatever the kind of thing is. A lot of the time it's used as a treatment in other instances. It may be used after an abortion, whether spontaneous or therapeutic, to remove the retained products of conception. A D&C is always performed after an incomplete abortion. So not only they use the word abortion, but like miscarriages, that's a big thing why they do that too. Sometimes you'll have like young women come in and they'll say something's wrong. I don't feel the baby moving. It's been this long and this long. You do an ultrasound to confirm no heartbeat. And sometimes they want to wait a few days just to make sure, which is fine. But after a while, you have to, if your body's not expelling it, you have to go in there and get it out, because it can cause infection and it could potentially kill the mom. So a lot of the time they'll go in there and just like take everything out. Okay, so nursing considerations for this. Carefully monitor the client to make sure that she can void and that she does not experience urinary retention. They say just give them Tylenol, ibuprofen. That's going to cause some severe cramping, so if you have anything stronger than that, just like a 1-time or 2-time dose, just give it to them. It'll be nice for the woman to have that. But ibuprofen outside of the hospital usually. Make sure they can pee, because the D&C is often done on an outpatient basis. Teaching is vital. Teach, educate. You'll almost always have like pamphlets to give to your patients, or discharge instructions to give to them. Go over with them. Like, I don't care if they're the smartest person in the world, just like read it to them to make sure they really understand. Okay, then you have what's called a hysterectomy and pelvic extentoration. So hysterectomy is a surgical removal of the uterus. It may be performed for a variety of reasons. Maybe cancer of the cervix, ovaries, or uterus. Or to treat uterine fibroids. Severe endometriosis or prolapse following uterus can also be the reason why. Then you have cosmetic breast surgery. So a mammoplasty is a plastic surgery revision of the breast for that. So then you have like augmentation, all that kind of stuff. Then you have mastectomy, which is a surgical removal of the breast. It's discussed later in the chapter. So teaching feminine hygiene. This is a tough question. So nurses are in excellent position to teach clients about personal hygiene. Teach women, wipe front to back to avoid any bacteria from the rectum to go into the vagina or into the urethra. Basically front to back. So menstrual discharge is an excellent culture medium for microorganisms. Teach them to stay clean and to just clean it. It's really cool though, the vagina is a self-cleaning thing, but the outside just needs to just be taken care of manually. So then there's a whole list here. Educating the client 91-1 on page 1665 about preventing vaginal infections. Let me see here. I think it talks about other things, but yeah, just like you think that, I don't mean to be like rude, but you think it'd be like common sense, but a lot of times people just don't know, which is fine. Just a matter of educating them. So front to back, wear breathing underwear. So cotton underwear is really great. Avoid tight clothes. Don't douche. Change it up a swimsuit. Let's see here. And then just if you're going to be sexually active, be aware if your partner has anything. That's really important not to get that. Have big discussions. So just be proactive in your own health. Don't be afraid to say no. Okay, let me see here. Then it talks about how the douche is super damaging to the vagina. It disrupts all the normal flora. It's super good to eat probiotic foods. I read this book one time. The scientist said if you eat acidophilus or if you have acidophilus every day, you'll live forever. Totally believe it. Okay, so then sometimes there's medication that you can insert vaginally. We'll talk about that later too. Okay, so disorders related to the menstrual cycle. Amenorrhea is the absence or abnormal stoppage of menstruation. If an adolescent female has not begun to menstruate by her 15th year, she should be examined or just checked on. A lot of the time, this nursing alert talks about sports. High intensity sports will stop your period, or if you're anorexic, or people during the Holocaust, like women would talk about how their periods just stopped because obviously they were starving. And so yeah, so it's important for that to take note of. Sometimes even like just being too thin will have you not have a period. So sometimes just gaining like 10 pounds will help instigate that to go. It's really interesting. It's fascinating. Anyways, menorrhagia is excessive bleeding in amount or duration during menstruation, so heavy bleeding. Metrorrhagia is bleeding between menstrual periods. It is abnormal and should be brought to a healthcare provider's attention because it may indicate cancer or retained placental tissue in the postpartum woman or in the woman who has a spontaneous or induced abortion or miscarriage. Sometimes when you ovulate, you'll have light bleeding, so that's normal. But if there's anything like super like sporadic in between like periods, that's abnormal. Then page 1667 again has a nice diagram on how to do breast self-examinations. Do it like once a month in the shower. Just like have a little note in there and say, oh, it's the 15th, let me just do it. Anyways, that's super important to do. Okay, so then dysmenorrhea is a painful menstruation. Very severe pain may be owing to an increase in prostaglandin secretion, which intensifies uterine contractions. So, so it often fades after childbirth. So, okay, cramping is totally normal with your period because your uterus is a muscle and expelling things out of it. However, if it's super painful, it might be associated with other things that we'll talk about later. But cramping is normal, okay? I don't care what anybody says. So PMS, it talks about how this is like abnormal. No way. PMS is totally normal, and it talks about how the hormones are just fluctuating in your body and how there's so many different things. All I know is that a week before my period, I am like super angry, like everything can't make me happy person. And then I have my period, I'm like, oh, it's my period. That's why I was so mad. Haha. Sorry, forgive me. So let me tell you, everybody, most women go through it. I mean, they say, oh, it's your hormones are not balanced. It might be a reason why, blah, 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 blah. Anyways, just know that that PMS, so the premenstrual syndrome, is usually like women are crying more, they have different cravings, they're more emotional, you know, blah, 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 like totally. Just know that if it's like really depressing though, like if it's associated with depression, then that is what's abnormal with PMS. But if it's like a week before your period, then your period starts and you're like, oh, I'm like way better, you're fine. And then it talks about myalgia. Breast pain is a common symptom. Totally. It'll be tender. Okay. Let's see here. So it talks about how there's over like 200 symptoms of PMS. It's probably more than that. Okay. So toxic shock syndrome. That's a big thing. That was a big thing when tampons first came out. Because, so what happens is, okay, so toxic shock syndrome is caused by super antigen toxins that developed from bacterial skin infections from either Staphylococcus aureus or Streptococcus pyogenes. So the infection manifests in typically healthy individuals who quickly become very ill. Hospitalization is generally necessary because of the need for aggressive supportive treatments such as IV fluids, medications to treat life-threatening hypotension, and endotracheal ventilation and management of renal failure and or multiple organ failure. So your body goes into shock, like septic shock. Boom, like you gotta like fix that real fast. So signs of it. There's a rash that may resemble a sunburn that will blanch when touched. It can be seen on any region of the body. Other symptoms include high fever, hypotension, general malaise, confusion, and altered level of consciousness, which can rapidly progress to stupor and coma. So multiple antibiotics are typically required. Toxic shock syndrome can be fatal within hours if not diagnosed or treated. Basically, the big thing with this is that when tampons first came out in the 70s, women were leaving them in for like days, and you have to take them out within like 8 to 10 hours or so, depending on the tampon. But usually it's like within 6 to 8 hours they recommend taking out. But with them leaving it in, it became the perfect growing like thing inside the body to cause this bacteria to grow and basically kill all these young women who just didn't know or didn't understand. Super important to teach like women that are using tampons, take them out, use a new one. Don't mess around because you will cause this huge infection and you could get killed. Okay, so toxic shock syndrome, big thing, test question. Okay, discomfort of menopause. So menopause again is a cessation of the menstruation. Occurs usually at the ages of 45 and 50. Blah, blah, blah. So one of the first signs of approaching menopause is a change in the menses, change in your menstruation cycle. The amount of flow lessens and the cycle becomes irregular. And finally, menses stop altogether. The most common symptom is the hot flash, with accompanying perspiration, palpitations, and fatigue. Although hot flashes are not serious, they are annoying and may embarrass the woman. Blah, blah, blah. So other symptoms include insomnia, anxiety, crying spells, fatigue, mood swings, and depression. Your hormones are all over the place. Your body's trying to regulate again. It's totally normal. They talk about how sometimes they give like hormonal therapy, like estrogen, if they want to. It's available as a pill, skin patch, gel, cream, or spray. However, it's an increased risk of cancer when you take external hormones. So, nursing considerations. A woman often needs emotional support during menopause. Teach her to realize that menopause is a normal physiologic function. Everybody goes through it. Everybody's going to get it as they advance in age. So, quick thing about women health. A lot of the time, you will repeat your mother's cycles, I guess you could say. For example, like my mother-in-law, her grandma, menopause, age 42. Her mom, 42. She, 42. Like, you will follow your mom's patterns throughout your life. So if something is like off, be like, yo, mom, what's up? Did this happen to you? Most of the time it did. So you can kind of like, I don't know, like estimate or guesstimate like what could happen in your own body. And that's the same with like cancer and things like that. Genetics play a huge role in your body. Okay, so then you have induced menopause, which is usually done from like a hysterectomy, which includes the removal of ovaries. So you have a bilateral oophorectomy with the hysterectomy. If only the uterus is removed, the woman will have no menstrual flow. However, normal hormonal cycles will continue. A young woman who has had both ovaries and the uterus removed will often be maintained on an estrogen therapy. So usually if they're younger and they have this happen, they will continue hormonal therapy just to continue like a normal like way of life, but it depends. Okay, so structural disorders. You have what's called a vaginal fistula. So a fistula is the opening between two organs that normally do not open. So a vaginal fistula, it may develop between the ureter and the vagina. So you have what's called a ureterovaginal. So it's the bladder and the vagina. And then the vesicovaginal, or the vagina and the rectum, retrovaginal. So basically with any hole, there can be leakage. So with the retrovaginal, you could have like stool coming out of the vagina. With the bladder and the vagina, see the vesicovaginal, that could be urine coming out of the vagina. And then the same with the ureter vaginal, the ureter and the vagina. You could have like things coming out where they're not supposed to be coming out. So a long-standing fistula is difficult to repair successively because the tissues are eroded. Infection can become an additional problem. Most of the time, you'll fix the fistula surgically, but you kind of have to see. So make efforts to assist the healing process by building up the woman's resistance and by keeping her as clean as possible without perineal irritation. So just like hygiene is super important if there's any fistula going on. Okay, so then you have what's called a cystocele, is the downward displacement of the bladder toward the vaginal orifice. It is most often seen in women who have experienced frequent deliveries or deliveries close together, childbirth. Let's see here. So Kegel exercises are super important just to kind of help strengthen that bladder to keep it from like, incontinence. Then you have what's called a rectocele, is the upward displacement of the rectum toward the vaginal orifice. Rectocele is most often the result of injuries during childbirth. The woman with rectocele will experience backache, fatigue, heaviness in the pelvic region, and bowel difficulties. She will have incontinence, flatus, and alternating constipation and diarrhea. Surgical repair of the posterior vaginal wall will often return the rectum to its normal position. Okay, cool. Then you have what's called the prolapsed uterus. Oh, I feel so bad for women that have this. I feel really bad. Anyways, it's when the uterus sags and is then falling into the vagina and possibly out of the vagina. And so there's different degrees of it. They usually would complain of a nagging back pain, constipation, or stress incontinence. They may feel pain with intercourse. They may also have irritation of it from like things rubbing against it, like their underwear, their clothing. A hysterectomy may be performed to eliminate severe prolapse. Some surgeons prefer to resuspend the uterus back into its normal position, particularly for younger women. So they have what's called a pessary, and that's what it helps keep it in place, and it wraps it back up. And you just have to teach women how to clean it, maintain it, and just the signs, things to look for if things are going abnormal. And they just recommend cleaning with warm soapy water at least once a week. Kind of cool. You just keep it in place for like a week. So just as long as you teach them hygiene, you'll be good to go. It can also be removed for comfortable sexual intercourse and sometimes for bowel movement. So just kind of depends. Okay, so then you have abnormal flexion of the uterus. So just know that it can happen from childbirth or it's congenital, and it can just be displaced showing of the uterus. Kind of interesting. It may cause backache, dysmenorrhea, or sterility. Surgery can correct it, or you're just kind of born with like a different shaped uterus. Then you have inflammatory disorders, vulvitis. So it's inflammation of the vulva. It may result from trauma, blah, 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 blah. The goal of the treatment is to determine and eliminate the cause. Then you have vaginitis. It's the inflammation of the vagina. So normally vaginal secretions protect against infections. However, trichomonas vaginalis and or Candida albicans or candidiasis can cause yeast infections and like irritations down there. So let's see here. So trichomoniasis is usually transmitted sexually from STDs, whereas Candida albicans can just like happen from like a overgrowth of yeast, so a yeast infection. So let me see here. So you'll have what's called leukorrhea, which is whitish discharge from the vagina. Usually, like with yeast infections, like that cottage cheese type discharge will happen. Lots of itching, lots of irritation. So sometimes mild anti-anxiety agents or analgesics lessen the effects of the itching. And that's when you're going to do usually like a tampon type medication. So the insertion of a medication. So like nice miconazole nitrate is a big thing, or metronidazole is a big thing for like any sort of infections like that. Just have to educate them. And then just know though that if a pregnant woman contracts trichomoniasis, treatment is necessary, although it can be postponed until the 2nd or 3rd trimester because of unknown effects of the drug on the developing fetus. Untreated trichomoniasis can lead to a fragile cervix that will be unable to maintain pregnancy or withstand delivery. So it's important when you become pregnant, you get a pee test, you see if you have any infections, and if you do, treat them right away. Or treat them in the 2nd, 3rd trimester. So then there's a whole little box about self-care with a yeast infection. So it's really good, it's interesting, just let them know, it just sucks, it's going to take time, and it will get better. Okay, so then I'm going to skip to cervicitis. So cervical organisms cause cervicitis, inflammation of the cervix, notably Staphylococcus, Streptococcus, and Gonococcus. Cervicitis is often diagnosed after childbirth because of trauma. Sometimes frequent douching or STDs, forgotten tampons can cause it. Just know that antibiotics are the mainstay of treatment. Then you have endometriosis. This is a really nasty thing for a woman if they get this. So it's a painful disorder in which the tissue that lined the uterus, known as the endometrium, travel to areas outside of the uterus. So basically, you have the endometrium lining. If little tissues or cells of that like float away into different parts of the body, it's going to cause the same thing as like the thickening. It's going to break down, it's going to cause bleeding, and it's going to cause pain. But it's going to be painful because it's not going to be able to just like leave the body like it would out of your uterus. It's going to like be in different parts of the body causing the pain to happen. And you're like, what is going on? So areas that are most commonly affected include the ovaries and the bowel. So then it talks about, so retrograde menstruation is the most likely cause in which displaced cells stick to pelvic walls and tissues where they act as typical endometrial cells. So that really sucks. So signs and symptoms of endometriosis are pelvic pain that worsens with menstrual period. Pain tends to increase over time as the endometrial tissue spreads. The severity of pain may not be a reliable indicator of the amount of tissue that has been transplanted. Relief of pain occurs with pregnancy, after menopause, and during estrogen therapy. So basically when that lining is not being sloughed out, that's when they're not having any, like with like the inhibiting of that. So pregnancy, you won't have a period. Menopause, you won't have a period. So anytime you're not having a period, you won't be in pain. So symptoms of menses commonly are associated with some degree of discomfort or pain. The pain of endometriosis typically is more severe. It begins earlier in a woman's cycle and ends several days after the end of a period. So sometimes endometriosis includes the abdomen and lower back areas. Blah, 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 blah. If the woman desires children, Healthcare providers may recommend pregnancy as a type of treatment for 2 reasons. First, endometriosis may eventually result in sterility. And second, because endometriosis is influenced by hormonal changes, symptoms often improve during and after pregnancy. So, but if they don't want to get pregnant, then they usually give them hormonal therapy. So they'll give them gonadotropin releasing hormone, such as Lupron, and that can force endometriosis into remission, which in effect creates an artificial menopause. So it basically stops the period, but if you stop that therapy, then it's gonna, like, your menstrual cycle will return. So if pregnancy is undesirable, medications may shrink the endometrial tissue. So there's like different medications with that. So let me see here. Then we have what's called pelvic inflammatory disease, PID. It's an infection of the ovaries, oviducts, uterus, or pelvic cavity. The most common causes of PID are 2 forms of STDs, chlamydia and gonorrhea. So signs and symptoms. So if there's no symptoms, it's usually infected with chlamydia. However, commonly initial and noticed symptoms include a foul-smelling vaginal discharge. The client also complains of backache, abdominal or pelvic pain, fever, chills, malaise, nausea, and vomiting. So if those are there, then it could be gonorrhea. So complications include chronic pelvic pain, infertility, ectopic pregnancies, abscess formation, sepsis, and death. The reproductive tract, especially the fallopian tubes, can be permanently scarred, leading to chronic PID infections and permanent infertility. Get checked out. Tell your patients to get checked out. Don't wait around. Diagnosis is usually from a pelvic examination, and then cultures and sensitivities of vaginal or cervical discharge, and a urinalysis. Treatment, antibiotics. So a woman who has had PID is more likely to have an ectopic pregnancy. An ectopic pregnancy is likely to cause rupture of the fallopian tubes, which results in life-threatening hemorrhage. Treatment of sudden spontaneous abdominal pain in a reproductive age female is an emergency. Don't mess around. So nursing considerations for PID is antibiotics and pain relief are super important. Then I'm going to skip this vulvodynia, and I'm going to jump to neoplasms. So basically, they made a box table 91-1, cancers of the female reproductive system. Refer to this box, read it, understand like which is which. So just know that with breast cancer, your risk factors, usually the older you get, or if you have a family history, or if you're doing any sort of like hormonal therapy, big things. And then cervical cancer is usually because of HPV, human papillomavirus, so be aware of that. Let's see here, then they have like different fibroid tumors of the uterus. Sometimes fibroids can just like live in the uterus, which suck, and can inhibit pregnancy, like the implantation of a zygote. So let me see here. So cancer of the cervix, ages 40 to 55, is the most common one in women. Signs and symptoms is usually bleeding is the first sign of cervical cancer. If a woman is pregnant and cervical cancer is discovered, treatment is usually delayed unless they recommend not to, but that's between the woman and her provider. So let's see here. So caring for the woman undergoing a hysterectomy. Let's see here. Just know that bleeding is a big thing, and that you'll probably have a full catheter placed with the hysterectomy, and then just teach them how to do Kegel exercises to like regain that control. A peri bottle, so just like a little bottle that like cleans down there, is really important. Vaginal packing may be there, blah, blah, blah. So then you have what's called breast neoplasms. So chronic cystic mastitis. Cystic disease is the most common breast disorder in women between the ages of 30 and 50 years. It is believed to result from a hormonal imbalance and is related to the activity of the ovaries. Caffeine can even aggravate cyst formation. So talk to them about that. Box 91-2 on page 1679 is a nice list for risk factors. So again, family history, oral contraceptives. If you've never had children, postmenopausal hormone therapy is a big thing. But again, refer to that box on page 1676, table 91-1. That's a good thing to refer back to with the cancers of the reproductive system. Let's see here. So warning signs and symptoms of breast cancer, page 1680. If there's lumps, if there's swelling, if there's discharge of the nipple, things like that, you're like, what's going on? Let's see here. And then there's like reconstructive surgery. Wow, I'm so sorry. I really have to pee. Oh my gosh. Okay. So reconstructive surgery, women who have who have had a mastectomy have the option of breast reconstruction. Super great for the image, super great for the women. It just takes time, but when the end result is done, it's usually a great thing, like to either for that self-image, that confidence, or just because that's just what they want, which is great. And then there's like different exercises the woman can do post mastectomy. So just be aware though, I'm skipping through a lot of this, but just know that when women have breast cancer, they will remove the breast tissue, but since the lymph tissue is so connected in there, they usually remove like some of like the lymph nodes, because that can, like the cancer could travel through the lymph nodes. So it's super important to know that, so they can have like different lymph issues with that. So be careful with like taking blood pressure on that side, like don't do it. Talk to them about it, the area can be sensitive. Like this nursing alert is really good, basically just like saying all of that on page 1683. The most common cause of lymphedema in the woman who has had her lymph nodes removed is infection. So many precautions are necessary to prevent damage to the skin and tissues. Avoid taking blood pressure, giving injections, or drawing blood on the operative side. Protect the arm against future infection. Report signs of infection in the arm or the hand immediately. In many facilities, a pink armband is applied to the affected arm to alert staff to these precautions. So it's like limb alert. Yeah, don't touch it. Anybody with any sort of like constructive surgery on their body, changing like their image is super like emotional. So it's really important to like give them support groups, give them information, and just be a supportive person in their life when you're helping take care of them. So again, I kind of breezed through this, but I just pointed out the things I really wanted you to know. Understanding the woman's cycle, understanding things that can go wrong. It's just going to happen, and just take it on a day-by-day basis when you're taking care of your patient with that. Anyways though, if you have any questions, you know how to get a hold of me, and I hope this helps. Thanks you guys.